response to the Dobbs v. Jackson Women's Health Organization decision, which overturned Roe versus Wade and eliminated the constitutional right to abortion, we have seen some health insurers, but really a bunch of different corporations have stepped up to offer new benefits to cover travel for employees who are located in states that are hostile to abortion access, where access has been eliminated. And those travel benefits have taken a couple different forms. Some companies are explicitly adding travel benefits to their pre-existing insurance policy. Some have created reimbursement programs where the employee would have to front the costs up front and then get reimbursed by the company. And some are stipend programs and different varieties beyond that. Travel benefits, I view it as a necessary but not sufficient component of helping people access abortion. It's more of like a stopgap, but not a remedy for the loss of abortion access for people who are in states that have banned abortion. The design of these benefits really matters, and we've seen sort of like wide variance in the different programs. For example, reimbursement programs aren't really going to help people who have low incomes and might not be able to afford the cost of traveling and fronting those costs up front. There's also things to consider, like part-time or hourly employees might not qualify for these travel benefits. People under 26 might be on their parents' insurance and might not qualify for those travel benefits, and people on Medicaid. There are also really important network adequacy questions that I haven't really seen good answers to, like whether or not companies' existing provider networks include abortion providers, or if they're pairing these travel benefits with an expansion of out-of-network providers or in-network providers, and whether or not they're subject to cost sharing. Like, are these new benefits subject to a deductible? Because if someone has a high deductible, then it makes this travel benefit basically moot. There are also really important privacy concerns about whether or not the benefit will be handled by a company employee or a third party, and whether or not employees will be forced to tell their boss whether when they are seeking an abortion in order to get their travel reimbursed, because there are like really significant concerns around retaliation, or even just like implicit bias could impact an employee's future trajectory in terms of things like promotions. So telehealth medication abortion, which I think is a separate issue from this, is a safe and effective way to end an early pregnancy. The FDA actually recently removed the unnecessary requirement that previously forced people to pick up the medication abortion pills in person at their doctor's office or clinic. And so now patients can have a virtual consultation with their healthcare provider at home or at another place of their choosing, and then have the medications delivered to them. It's a really important tool for expanding access, particularly for people who live in rural areas or live in areas that just don't have a provider near them. The cons to this is that we've seen anti-abortion legislators do everything they can to make it difficult or impossible for people to access telemedicine abortion care. And these attacks on this service delivery will constrain the potential that this method has for expanding access. For example, there are currently 19 states that ban the use of telehealth for medication abortion, either explicit bans in statutes or by requiring in-person dispensing of medication abortion pills. In 2021, when we were looking at different state legislative sessions, we saw a dramatic increase in the number of restrictions that were being introduced both on the use of telehealth for medication abortion, and also just on medication abortion independently. And we've seen this continue today. And the one other thing I would say is that while telehealth and the use of telehealth for medication abortion service delivery is great, it's not a solution to Dobbs. And people should be able to choose the type of healthcare that they want. Everyone should have the right to determine if they want to have a medication abortion or a procedural abortion. And so even though I think telehealth medication abortion is great, people still deserve access care where they're at.